Hi there, my name is Sarah Moore. I'm part of the Vantage team with the Department of Health and Human Services, and part of my role is to support training for the Services to End and Prevent Homelessness Department and the COC. Today, we're going to be looking at how to effectively share assessment scores with clients. So this is a fairly recent change. So we're going to be looking at the change itself. We're going to talk about some general considerations and then review some assessment specific considerations. We're also going to take a brief look at the vulnerability index and the county policy that's relevant, which is the notice of privacy practices, before a quick knowledge check. So in previous assessment trainings, it was explicitly stated not to share scores with clients because a random number wouldn't mean much to them without any context. And for clarification's sake, clients have always been able to request and receive copies of their records, including the information in HMIS. So we are removing any restrictions on sharing assessment scores with clients because we want to put more information into the client's hands. We want clients to feel empowered to navigate through the continuum of care. Now we're going to look at some general considerations when sharing scores with clients. And a very good rule of thumb is that for any interaction you have with a client, you should always start by asking questions. How are you doing today? Have you ever heard about the CES? Have you ever talked to somebody like me before? You want to take the temperature of where your client's at within the system and how they're doing today, and couple that with thinking about your goal for the meeting to make sure those things match up. You're asking yourself, is this the right time for this conversation? That way, if it's not the right time because the client's having a crisis, you can kind of like pivot and address that crisis instead. So you want to make sure you're reviewing the context when you're looking at assessment scores with clients and how that relates to the CES list or the coordinated entry system list. One important factor with the CES list to remember is that it's only one option to resolve a client's homelessness, and it should not be viewed as a waiting list. Another important thing to be mindful of when you're sharing scores with clients is can you not only talk about how CS functions in general, but can you talk about the differences between the programs that the CS list will help people get matched to? So it's more than just rapid rehousing is time limited and PSH is not. The focus of these programs can be different, and knowing how they differ would be important to then be able to explain to your client. And it also is going to impact treatment planning with the client. So when you're looking at scores and they kind of divide it by self-resolve, rapid rehousing, and PSH, like the VI SPDAT or full SPDAT, you want to make sure you can talk about the differences kind of within what those scoring categories might mean, what programs they might be eligible for, what needs they might need assistance with. So it's important to be able to explain the context. You want to try to share scores in a trauma-informed way. So one of the main components of trauma-informed care is being transparent. So you want to explain the role the assessments play for the CES list before you complete them with clients, and normalize their completion. Everyone that enters shelter completes the same assessments, or everybody that lives in PSH typically has an annual acuity scale completed. Otherwise, folks might feel singled out. Clients also might have been told things about the system that are untrue, like if you wait long enough, you're going to get a one-bedroom apartment. So some of what you're doing when you're being transparent is level setting. You're explaining what is possible and what isn't possible with the way the current CS functions. The other thing you want to do is recognize your place in the system. So you want to think about your client's past interactions with the system and how you represent that system. For example, if as a white woman, I ignore structural racism, then I would be putting undue pressure on my clients and not doing what I need to do in order to allow them to feel comfortable to be honest with me. One way you might achieve this is by saying some statements to your clients before you start doing the assessments, like, I know not everyone that looks like me treats someone that looks like you fairly, but my goal is to treat you fairly, provide you with excellent service, and recognize your unique situation. I can't effectively help you if you're not honest about what's going on, what you're struggling with. If I don't know about it, I can't help you with it. Lastly, you want to make sure if someone is concerned about their scores, you're going to validate those concerns. So step 1 is listening. Step 2, acknowledging their point of view. That's the validation part. And then step 3 would be offering clarification when needed. A client might say to you something like, oh, I don't want rapid rehousing. I don't want roommates. So how you would validate that concern is start out by saying, I hear you clearly. You don't feel comfortable living with other people. Rapid rehousing can work to house people without roommates, like a 1-bedroom apartment, or they can try to help you try to find a situation that might minimize interaction with housemates, like a basement apartment with a separate entrance, but maybe a shared kitchen. Your range of options is going to depend a lot on your unique situation. What's your income situation like? Do you have a rental history? What is your credit history like? Do you have any criminal history that needs to be addressed? You're going to also make sure that you're reassuring folks that scores can change at any time due to a variety of factors. So you can say something to the client like, after we've gotten to know each other better, we can always revisit these scores to see if anything needs to be updated based on that additional information that you might share. You want to make sure that the client's in the right state of mind to have this conversation. If you've attended my acuity skill trainings, you'll remember when I reviewed fight, flight, freeze, or fawn. If someone's in one of those 4 crisis states, then they're not going to be able to absorb the information you're sharing. And how do you know they're in a crisis state? The client might seem elevated. They might have like kind of turned in on themselves. Basically, if there's any sudden change in their demeanor, that might indicate that they're in some kind of state of crisis. Also, if someone's under the influence of drugs or alcohol, if someone's inebriated, it's not a good time to have a tough conversation talking about housing placements. If someone just got bad news, somebody just had a death in their family or their disability claim was rejected, then probably not a good idea to have a tough conversation about housing placement. And then lastly, are you going to be out of the office? So it's always a good idea to avoid having a conversation like this on a Friday at 4 p.m. or just before you go on vacation. You don't want clients to have questions and then they have to wait days to get those question answers. That just leads to frustration on the side of the client and then will destroy any rapport that you've spent time building with that person. Now we're going to look at some helpful tips for specific assessments. So the first is the VI-SPDAT. So this assessment is 100% self-report, and therefore you should only be completing this assessment with the client present. If you are doing so on paper, then you would still add up the scores without the client and then review the total score with them after some time. So it could be, hey, we've done the VI-SPDAT. I need you to step out for 10 minutes while I do the addition, and then we're going to come back and revisit this. Or you say to the client, we started this assessment today. We're going to finish up our discussion at our next meeting. If you're completing it in HMIS, then the system will score it for you, and you can immediately review that score with the client. Remember, you need to review not only the number, not only the score, but what it means in terms of the CS process. So if you say to somebody, you scored a 7 and that means rapid rehousing, you don't just stop there. You have to explain, okay, rapid rehousing is a program that is XYZ. This is what's likely going to happen with the CS list because you score for rapid rehousing. You have to provide a lot of context. Another important tip to remember, before you complete a VI-SPDAT, you should be checking HMIS to make sure a full SPDAT hasn't been completed in the past. Anytime a client has had a full SPDAT completed by another provider or in your own agency, then you would continue to complete full SPDATs from that point on. So just a helpful tip in general about VI-SPDATs. Might save you some time. So now we're going to look at the full SPDAT. So you're typically completing the full SPDAT assessment without the client present. However, you should be letting the client know in advance you plan to complete it, what information you're gathering, and your reasoning. At this point, you also might partner with a client to get releases of information signed if you're trying to contact a community provider that isn't part of the COC and you need that collateral information. You want to say something to the client like, after getting to know you better, I don't think rapid rehousing would be the right program to help you obtain and maintain housing. I'm going to complete a full SPDAT, which is similar to a VI SPDAT, but takes a deeper look at your situation. At this point, it's always good to ask the clients if there's any important information they want to share. One way to do that is simply to ask the client the following question. Is there anything I haven't asked you about that you think is important that I know? I use this question every time I'm assessing somebody in the ER or finishing up housing assessments with folks. And you'd be surprised. You may have gone through the whole VI SPDAT, and now you're doing a full SPDAT, and you think that you've gotten everything covered, and you ask the client something like that, and they may bring something to the table that is very important that those other assessments didn't quite get to, or the client didn't connect the dots. So that important information can get missed if you don't ask an open-ended question like, is there anything I haven't asked you about that you think is important that I know? Lastly, even with the full SPDAT, you should be reviewing the score and the outcome with the client. So saying something like your full SPDAT score is a 31. This means you now score for mid to low intensity PSH. Mid to low intensity PSH looks like XYZ. And then you describe what the programs potentially look like and how the CS list functions for mid to low intensity PSH. Lastly, we're going to look at the acuity scale. So the acuity scale training is where I was previously saying explicitly not to share scores with clients. But those trainings have been updated to remove that specification. Also, we're going to talk about it here just to make everything crystal clear. So you're typically completing the acuity scale assessment without the client present, just like the full SPDAT. And just like the full SPDAT, you should be letting the client know in advance you plan to complete it. You're also normalizing that every client in the COC has this assessment completed at least once a year, whether someone is in shelter or they're housed. If somebody is in shelter and you've completed an acuity scale assessment, then you're going to review the vulnerability index and how that relates to CES. We are going to look at the vulnerability index next. However, if you have a client that's housed in, say, PSH, and you're completing the acuity scale because of your PSH contact requirements, you might be reviewing how the scale is used for billing requirements, specifically visit frequency. So if somebody's a high acuity, they might have more visits every month from their housing case manager. So you're kind of reviewing that with the client. You're reviewing with the client how their visit schedule is based on their vulnerabilities. Lastly, the guidebook has been updated to reflect this change. It needed to be updated anyways to expand some areas that needed to be fleshed out. We previously had the last version of the guidebook for almost 2 years. So I've taken everything I've learned in that last 2 years to update the guidebook and remove any instructions that say not to share scores with clients. Please be sure you're using the December 2025 guidebook from this point on, and there will be a date on the guidebook so you know that you're using the most current version. So back to the vulnerability index. This is the vulnerability index. All of these items are pulled from the Montgomery County Acuity Scale assessment, except the ones that are starred. So currently unsheltered and veteran designation, those are pulled directly from HMIS. Everything else is pulled from the acuity scale. So these scores are used in order to sort folks on the CS list for PSH. For example, somebody with a higher score on more of these items will be higher on the list for folks in a specific category, like high intensity PSH. Say we have one high intensity PSH slot, there's an opening on the CS call, and there's 10 people that need high intensity PSH. How do we know who gets the slot? It's based on vulnerabilities. The higher score you have, the more vulnerabilities you have, the higher your vulnerability index, and then you're going to be higher on the CS list for that opening. This is covered in page 44 of the new CS Policies and Procedures Manual that can be found on the CEF website. Now we're going to look at the relevant county policy, the Notice of Privacy Practices. So the Notice of Privacy Practices has been reviewed previously with the COC. I am not going to go too in depth because of that previous review, and there's information available about the Notice of Privacy Practices from that previous training. Please let me know if you need it. What is relevant in the NOPP, or the Notice of Privacy Practices, is what's bolded. the important takeaway is that this policy covers a client's rights to their information and provides instructions how to obtain that information. The link to the Notice of Privacy Practices in English and the 5 other primary languages spoken in Montgomery County can be found here on this link, and that will also be available LinkedIn Talent or in YouTube in the comments of this training. So if you take a deeper dive in the NOPP, page 6 really focuses on clients' rights to information. This is an excerpt from page 6 of the NOPP. Again, the link at the bottom takes you to the document itself. The most important thing to remember is that all requests for information must be made in writing. That's the key takeaway. This again is pulled straight from the NOPP. This is information that gives you more specifics of how to make a data request, where to send it, who to contact, etc. Again, this is pulled straight from the NOPP. The important thing is that the request must be made in writing. That can be either via email or via hard copy. There also is a DHHS client request form that can be used, and we're going to look at that next. So this is what the form looks like in English. It is translated into the 5 other primary languages spoken in Montgomery County. Per the county privacy officer, this form is not strictly required when someone is asking for access to their own record. The only requirement is that the request must be in writing and that the request is specifically clear enough to act on. This form can help clients or customers be more specific about what they're looking for, and it can kind of cut down on back and forth communication when the written request is unclear. Now we're going to do a quick knowledge check. So true or false, the best time to complete a client's assessment and discuss scores with them is on Friday. What do you think? True or false? If you said false, you'd be correct. It's actually better to review a client's assessment scores earlier in the week so they can ask for clarification right away instead of having to wait the whole weekend for an answer. Next question, true or false? When you share scores with clients, you should only give them the number and nothing else. If you said false, you're correct again. You must give clients their score and an explanation of what that score means, including the overall context of how the CS functions and how that score relates to that process. Last question, true or false? The county's Notice of Privacy Practices, or NOPP, covers all types of records requests. If you said true, you would be correct. The county's NOPP does cover all types of records requests. That is the end of the presentation for today. If you have follow-up questions, do not hesitate to reach out to me. There will be information how to do so shared on the next few slides. You can email me, you can call me, you can shoot me a text. Thank you so much for attending the training today. I hope you have a great rest of your day. Bye-bye.